Democrats in the state legislature want to know where $100 million went. They say it vanished even after an agreement to spend that money on adult mental health programs.
As Dennis Owens reports, there are no magicians in Harrisburg, just politicians fighting over cash and how it should be spent.
I was experiencing wellness and was productive.
Kate Fetzer says she's battled mental illness and bipolar disorder for decades, was coping until her psychiatrist left the practice.
But I was told that there were no other providers, no appointments. Just, sorry, we can't help you.
A familiar story, professionals say. Those needing help far outnumber those giving it, and the problem's only getting worse.
Our wait lists for behavioral health continue to grow, as do the heartbreaking visits to emergency departments by people in crisis.
Well aware of the crisis, lawmakers passed this bill overwhelmingly and bipartisanly, steering $100 million federal ARPA dollars to adult mental health services. The state budget called for an additional $100 million for mental health in schools, two $100 million pots that became just one in the budget wash.
I think what they did was a little bit of sleight of hand. It was real cute.
Cute, but not pretty, Schlossberg says. They took the $100 million federal dollars, steered it to schools, and zeroed out mental health money for adults.
Both of these items need to be funded.
Senate Republicans insist that second pot was never agreed to. In a statement, Appropriations Chair Scott Martin said of pushing the $100 million to schools, we need to find ways to get services to those in need without having to recreate the wheel, adding he's pleased to advance a $20 million initiative that increases support for counties to provide these services.
For the Senate to take $100 million and say, never mind, it's not really a problem, we're going to fund this instead, is quite frankly, it's an appalling selection of priorities for people who need help the most.
And in Kate's case, not spending that money has its own costs.
So this resulted in worsening of the symptoms to the point where I ended up hospitalized. And it could have been a simple intervention.
Perhaps sorting out the $100 million for mental health is the latest item on the budget to-do list. At the state capitol, Dennis Owens, ABC 27 News.